We honor your service. We are forever grateful. And just as you have not forgotten your missing comrades, neither ever will we. Our servicemen and women have been doing right by America for generations, and as long as I am Commander-in-Chief, America is going to do right by them.
President Obama speaking today at Arlington National Cemetery, marking Veterans Day, of course. Earlier, Mr. Obama laid a wreath at the Tomb of the Unknowns. And although it doesn't get much coverage, and it's not political common wisdom, the annual pledges that politicians make on the 11th of November to uphold America's promises to our veterans, those pledges this year are being made in a very different context than they've been made in recent years past. Although you won't hear about it in the Beltway press, and you won't often see fights about it on cable news, we have, in fact, made huge progress on veterans issues over the last few years. Doesn't mean there's not miles more to go, but consider what's happened. Last year, Congress passed the largest increase in the Veterans Affairs Department budget in the 77-year history of that agency. In August, the new GI Bill went into effect, the biggest commitment to veterans education since the first GI Bill was passed all the way back in 1944. Last month, President Obama signed a landmark advance funding bill that gives the VA money to operate a year in advance. It's one of those things that sounds really boring, but it makes a huge difference as to how well that agency is able to meet its promises. VA health care is now accessible again to a whole class of hundreds of thousands of veterans who'd been cut off from eligibility by the Bush administration in 2003. Symbolically, the First Lady of the United States, Michelle Obama, early on identified military families as one of her marquee issues as First Lady. The general, famous for bucking the Bush administration in the lead-up to the Iraq War, who in fact got fired for that, was put in charge of the Veterans Affairs Department in the Obama administration with a clear mandate and a clear expectation that he'd buck the system and get things done at the VA. Now, again, this is not to say that all this progress is just a done deal. There are more than 20 million veterans in this country. The VA is a huge bureaucracy. It still screws up plenty, and veterans still have a lot of unmet needs. But realistically, in terms of progress made, distance covered toward keeping those promises that we talk about every Veterans Day, it has been a really big couple of years. And the reason you probably haven't heard too much about that, the reason this has all happened a little bit under the political radar, is because caring for our veterans is not that much of a political hot potato. With the weird exception of Congressman Steve Booyer this year trying to scare veterans into opposing health reform, Congress has generally been recently unified in support of getting things done for the men and women who have fought our wars. And then there's Senator Tom Coburn. The next big thing to happen on veterans issues in Washington is a Senate bill aimed at improving health care access for wounded veterans, offering assistance to those who care for those veterans, ensuring equal access to care for female veterans, expanding care for veterans in rural areas. It's called Senate Bill 1963, and the reason that it has not yet been passed is not because it's held up in partisan wrangling or something. No, this has huge bipartisan support. The reason this has not yet been passed is because of one guy, Republican Senator Tom Coburn of Oklahoma, who has put a personal hold on the bill to block it from coming to a vote. He is the only senator to do so, and it's earned him some of this from some of his Senate colleagues.
There is no excuse for not supporting our veterans and their caregivers. They have earned it, and they have earned better than what they have been provided up to date. The hold is unjustified and obstructing the Senate from fulfilling its obligations to our veterans.
Mr. Coburn has attempted to explain this hold by claiming that he can't allow this bill to go forward because he doesn't know how it's being paid for.
If we want to pass a bill, then let's be honest about what it costs, and then let's go do the hard work of paying for it. Rather than saying we can do this, then we can turn our backs on the generations that follow us.
Mr. Coburn went on to say he thinks that 90% of America's veterans would agree that this bill shouldn't be passed. Now, Senator Coburn insists that it's nothing against veterans per se. It's just that he's opposed to voting for anything that isn't paid for by cutting something else. Senator Coburn's rule on that, of course, did not constrain him from voting for funding for the wars in Iraq and Afghanistan that made this veterans bill necessary. Funding for wars that wasn't offset by anything. In 2005, Mr. Coburn had no problem voting for an emergency war supplemental bill that directed $82 billion of unoffset dollars toward the ongoing wars in Iraq and Afghanistan. Here's how he explained that vote earlier this week. matter of record, did you vote for any of the supplementals?
One war supplemental.
That was unpaid for?
That was unpaid for.
How was the reaction to that?
No, that was. I think it was the first year I was here. But go look at who hadn't. I've not voted for one since because it wasn't paid for.
I've not voted for one since, unless you count the emergency war supplemental bill that Coburn voted for in 2006. There it is right there. Coburn, yay. Those wars, which Senator Coburn was perfectly happy to vote to pay for with absolutely no explanation of how we'd cover those costs, created more than 1.7 million new American veterans. He's now on principle not willing to pay for taking care of those veterans. Joining us now is Democratic Congressman Joe Sestak. Congressman Sestak is the highest-ranking veteran elected to Congress. He's a former three-star Navy admiral. He's also a candidate for United States Senate in his home state of Pennsylvania. Congressman Sestak, thanks very much for joining us tonight. Happy Veterans Day.
Happy Veterans Day. Thanks for having me on this topic very much.
I just have to ask your reaction, plain and simple, to Senator Coburn's decision to be the lone senator blocking this bill.
It's shameful. It's shameful and it's outrageous. We ask these men and women, my fellow vets, to go overseas and protect our lives, and then they come home and he doesn't want to protect them for only less than 2 weeks of a 7-year war. I was to a prison today, a penitentiary. I went to visit incarcerated veterans who had actually gotten there because of post-traumatic stress disorder that led them to substance abuse. This bill that he's blocking is actually going to block and stop the outreach programs that help veterans get treatment for it. A few months ago, I toured a nursing facility in Philadelphia for our seniors after 2 inspections failed to find the unsafe, unsanitary conditions there, and one finally found maggots, live maggots, falling out of a festering wound in one of our vets sitting there. And this bill that he's stopping is to enhance quality inspections. And then, not to go on, but why I'm so outraged. I'll never forget going to Bethesda and visiting about 6 vets one day, Marines, and 1 soldier. This soldier was a police chief, Hispanic police chief from Vermont, a small village, small town. Traumatic brain injury. His mom left her job to take care of him. The town, what a wonderful town, has never up to that date even filled his job because they wanted to honor him. And the mother, a caretaker, leaving her job, and this bill would have given her a stipend and health coverage so she could do what up until then we didn't have enough in the VA to do until the $10 billion you mentioned the last 2 years we got passed. How could this senator do this to our vets?
As a veteran and a legislator now, do you think there is a disconnect between the politics in Washington of voting to go to war and the politics in Washington of voting to take care of the people who come home from war? Do you see that those things are treated separately?
Without a question. Too often I've heard the term, take care of our troops. And there often seem to be just, let's put more into the defense budget for more weaponeering. Look, our troops are who they are because we invest in them, in their health care, in their education. We actually give them an economic opportunity. And when they come home, if we don't understand, as George Washington himself said, that our greatest recruiting tool for the future are going to be our veterans, we owe them the most sacred of obligations from cradle to grave. They're the few men and women who actually raised their hand and said, here am I, send me. And you said something, I think, early that's very important. And this Fort Hood tragedy brought it out. Less than 1/3 of 1% of all Americans' families are actually engaged in this war overseas. Of those 1.7 trillion who have served, that represents about 1/3 of 1% of American families. The strain and stress upon them, upon this mom who came back, this is politics at its worst. It's what most irks me about Washington, D.C. Somehow, they think strength is purely military force, not understanding it's our people. And they have forgotten that, particularly in this case.
Congressman Joe Sestak of Pennsylvania, candidate for U.S. Senate. Thank you again for your time tonight, sir. Happy Veterans Day to you.
Happy
Thanks.
Veterans Day. Thank you.